one of the great debates of the last 100 years. How does America provide health care? How do we pay for it? This is not a new debate. This has been going on for a century. About 50 years ago, actually 50 years ago, America decided that they could create a program of health insurance that would cover universally all Americans over 65. It's called Medicare, and it really does work. In the Affordable Health Care Act, there's a major portion of it that deals specifically with Medicare. It took $500 billion out of the pockets of the insurance company, an unnecessary bonus that they had been receiving for the previous 9 years, and transferred that money into benefits for seniors, specifically providing programs such as wellness, free visits to determine health status. Some 31 million seniors now have access to that. And because of the Patients' Bill of Rights in that legislation, discrimination in health insurance no longer exists in America. It's illegal for an insurance company to discriminate against an American based upon their age, their health status, pre-existing condition, their sex. Those things are passed now in America. This is all part of the Affordable Health Care Act. And indeed, a portion of it, which was demanded by the insurance company, is the mandate to buy insurance or to pay a penalty. That's now being debated by the U.S. Supreme Court, and we'll see which way it goes. But the rest of the pieces of legislation are extremely important. For hospitals in this area, this legislation would significantly reduce that portion of the uncompensated care. These are people that show up at the hospital emergency room and have no money for which to pay. And that cost is then transferred to everybody else, either taxpayers or onto your private insurance policy. That's partly dealt with, or largely dealt with, in this piece of legislation. It's much debated, and it's much maligned. The cost curve is changed as a result of this legislation. True costs are going up in medical care across the board, and Medicare, along with everyone else, is on the same rising tide. We need to deal with that. In the legislation is a major piece of cost containment called electronic medical records. All of us, if you're in Kaiser, you know what this is all about. There's money out there for clinics so that people don't have to go to the emergency rooms. Clinics are growing. Clinics are in place in this county and providing services to those who are underinsured or not insured at all. In 2014, there'll be an exchange which will provide an opportunity for all of us to shop for the very best insurance policy that fits our particular needs. So what's wrong with all of that? Nothing can be said that is perfect about any piece of legislation, but this takes a major step. Some 40 million Americans will now have insurance as a result of this legislation, and the cost curve is being bent.